It's a incredibly exciting and challenging time to be graduating with an MPH or a PhD and entering the field of public health. It's a time really of unprecedented opportunity. Every day there's new discoveries about the causes of disease and how it can be treated, the advances in precision medicine and sciences and treating diseases that were never treated before really has implications for the whole future of medicine and the potential that public health can play in that. So it's a very exciting time of unknown opportunity to help people live healthy lives. But it's also an incredibly challenging time with threats to public health, some man-made and some just environmental, that will tax and challenge the graduates going forward in a way that's almost never imagined. It will really require you to draw upon all of your skills that you've learned in school and that you brought to the university, as well as your personal fortitude and tenacity and ability to affect change, because the challenges are, as I said, both man-made as well as environmental. There's threats to the access to care for people who are sick. There are threats to the environment in terms of clean air and water. We have an epidemic in this country of opioid addiction and death, with more Americans dying from addiction than they're dying from car accidents, which is almost unimaginable. And public health is really charged with understanding and trying to ameliorate and prevent these types of unnecessary deaths from occurring. So the future, there's never a time where your skills and abilities and commitment are needed more than now. We hope that we have trained you well, that have given you the skills and commitment to make a difference when you go out into the workplace. We don't see this as the end of our relationship with you. We see this as really the beginning, that we'd like to see you as lifelong colleagues, and as you have needs and information needs, or hopefully some of you will decide to pursue advanced degrees in the PhD or planned Doctor of Public Health degree, you'll come back to Georgia State to advance your learning, either in a degree program or through continuing education, and we see you as part of our extended family. We went from, as I said, 4 graduates in 2016 to now we have over 600 alumni working around the world in public health. And the one thing I would say about our alumni when we get together for events is that they are making a difference in people's lives. They are doing things that will change the world, and they are proud of having received their training at Georgia State University. And we welcome you to that group. The last thing I'd like to say as kicking this off is, there's a very challenging world that we're in right now, and it tends to be hyper-partisan in terms of people not understanding where other people believe or do or act. The common ground is shrinking, and to be successful in public health, you need not to be blue or red or left or right. You need to be focused on helping people. You need to be focused on the facts, and you need to be focused on integrity and making a difference. And that's why you're in public health, and that's why all of our faculty are in public health, is that we believe that we can make a difference. It's not about being partisan, it's not about being oppositional, it's not about arguing with people, it's about making a case that will make a difference in people's lives. And there'll be challenges as you go forward. Not everyone will agree with what we do, but when you're driven by the science and evidence and approach it with passion and commitment and being fierce, and that's what you need to do. You need to be fierce in doing your job and making a difference, because to the extent that you do that, lives will be saved and you can feel good about the difference that you've made. So public health is a very noble profession. I'm convinced that you will be in the future, when you talk to your children and your grandchildren, you will be proud that you made this decision, and the parents in the room, you should be extraordinarily proud of the direction and commitment of your children in terms of how they want to earn their living and doing it in a way that will make a difference that will benefit others. So it's a privilege for me to be here today. Thank you for all your hard work, both the students and the families for getting them here, and for the faculty for making this a reality. And we'll proceed with the program. So thank you. Let me, moving forward, let me introduce Rodney Lynn. Rodney is the Associate Dean for Academic Affairs, and he'll proceed with some of the next parts of the programs. Rodney?
Well, good morning. So I want to start this morning by announcing this year's inductees to our Gamma Upsilon chapter of the Delta Omega Honor Society in Public Health. Founded in 1924 with over 13,000 members, Delta Omega is a national society that recognizes faculty, staff, and students for outstanding accomplishments in public health and for their dedication to the advancement of health of all individuals. So we are congratulating them on this distinct honor. I'm going to ask our inductees to stand and remain standing as I announce all the names. I'm asking that you please hold applause till all the names have been announced. We have 10 student inductees, 4 alumni, and 2 faculty inductees. The student inductees are Sushma Dahal, Farah Naz Suleiman, Camille Kramer, Nina Lee, Sarah Kobani, Mathili Bhatt, Amna Tariq, Mariam Shakil, Rabab Zahidi, and Barbara Yankee. Our alumni inductees are Ashwini Tiwari, Cordero Tanner, Colleen McCarty, Reginald Gooden, and our 2 faculty inductees are Christina Fuller and Dan Whitaker. Please congratulate our inductees on this honor. Next, I have the privilege of introducing our student speaker, Ms. Amna Tariq. To tell you a little about Amna is graduating from the MPH program with a concentration in epidemiology and a 4.0 GPA. Her thesis focused on identifying the predictors of adverse pregnancy outcomes. Throughout her time with us here in the School of Public Health, she served as the president of the Public Health Student Association. She works as an intern at the Georgia Department of Public Health and serves as a graduate research assistant for GSU Teams AmeriCorps program. In that role, she specialized in organizing, managing, and analyzing data to emphasize the importance of STEM education in marginalized populations in Metro Atlanta. Amna has worked with Dr. Gerardo Chowell in the School of Public Health on a Zika virus project studying the spread of the virus in Pan American countries. In addition, she is a recipient of the prestigious International Fellowship awarded by the American Association of University Women. The fellowship is awarded to approximately 150 to 200 individuals, women, from developing countries who've demonstrated a commitment to empowering women. She is a member of the Delta Omega Honor Society in Public Health, as I just announced, and a member of the Golden Key International Honor Society. AMNA intends to work with health organizations and governments to overcome obstacles in eradicating communicable and non-communicable diseases by planning, organizing, and supporting health promotion. Please welcome her to the podium.
Good morning, everyone. What a great day it is, and what joy and energy I feel in this room because we are graduating. Woohoo! On behalf of the graduating class of spring 2017, I would like to extend my greetings to the Dean of the School of Public Health, the faculty, the staff, students, family members, and the friends that have been the biggest support for us through this arduous yet a fulfilling journey. Graduation makes a small list of big life moments. At this time of the year, when we're just graduating, the feeling of responsibility is overwhelming. It's funny how time spent in school plays a monopoly in our memories. When I jog down my memory lane, it's all about an adventurous journey that I had at Georgia State. It was about embarking on a journey to love, learn, and explore at Georgia State University. So I want to congratulate you all because we're going to be graduating today. I come from an international background, like many of you, where we are from different areas around the world. And I have been amazed, shocked, and appreciative of the education, culture, and diversity here at Georgia State, time and again. My journey here has been great, and I am pretty sure it's a mutual sentiment that we share. School of Public Health has been a road to the understanding of diseases, the disease dynamics, the prevention and control methods. I learned throughout this time of 2 years here at Georgia State that in order to save lives, you do not need to wear a white coat. All you need is to understand the value and treasure the value of human health. I completed my degree in dental surgery from Pakistan, and during dental school, I realized and I saw the firsthand disparity in the provision of dental health resources. I also saw the acquirement of diseases by patients at the hands of doctors, dentists, and surgeons. And it made me delve deeper into prevention medicine to look into what we can do in order to prevent this around the developing parts of the world, and what the developed parts of the world have done in order to overcome all these things. I needed answers to figure out what can diseases do in the communities, why diseases spread in some particular populations and ethnicities, and how certain diseases create a cycle of havoc among certain populations. And I can assure you, and I'm sure you will agree with me, that this degree in public health has equipped us with the knowledge and the skills needed to answer those questions. It's interesting how broad public health can be and how narrow you can make it according to your own premise. I narrowed down my area of public health to infectious diseases, and not because how dangerous they are, but because how easily they slip away at the hands of health professionals. My grandfather was a self-made man whom you would aspire to become if you would meet him. He caught hepatitis C from a dental procedure at a very renowned hospital. That led him to develop liver cirrhosis. And it just happened that he was not there in the world when I was coming here to the United States to pursue my master's degree. That's how hard it can be to have those diseases if we're not controlling them. Developing countries are still fighting the hospital-acquired diseases, malnutrition, tuberculosis, and malaria that the developed parts of the world have already overcome. All of these dynamics and situations led me to follow a career in public health because I want to be the voice and I want to be the hand that saves the people from those diseases. Working on school profiles health data in the Georgia State Department of Public Health also made it very clear to me that how important it is to surveil the children in the schools so that we can save them from the horrors of diseases that we're in right now, like AIDS, syphilis, obesity, and cardiovascular diseases, because we surely do not want them to get all of those diseases. The degree in public health at Georgia State University has taught me a lot of lessons, but the three most important ones that I learned were to persevere, to never panic, and to be optimistic. By perseverance, I mean to be patient with the work that we do, because the results in public health are not fast, but they're delayed and impactful. All we need is to be persistent force of change. As Mahatma Gandhi says, you must be the change you wish to see in the world, and we are the change that we're wishing to see in the world. We need to be prepared and accountable for every step that we take. And we need to be optimistic. And by optimism, I mean you all. You are the power that will eradicate the diseases like AIDS, syphilis, obesity, and cardiovascular diseases from the face of the earth. We are the leaders that people can look up to. We are the guiding torch for a better future in the world and in the field of public health. Public health is such a distinguished field because it allows us to save lives of so many people and bring smiles on their faces, regardless of what race, religion, or color they belong to. And Georgia State University's diverse program of public health is a very clear example of this. Health is a very precious gift, and we need to take care of it. And so is life. But life is a difficult road, and we encounter rough patches during this road. Sometimes it's painful, sometimes it's trying. But we know we can do it because of the confidence, passion, and optimism that we have in ourselves and the public health community that we live with. We need to continue to discover something new, to try something new, and to keep on changing. And that is what we did here in our tenure at Georgia State University, in the heart of the public health capital. With a degree in public health, we will be able to be the voice and force that promotes health and wellness in the developing and developed worlds alike. I foresee us all working in our respective concentrations, overcoming the obstacles in eradicating the communicable and the non-communicable diseases, and making policies and strategies to overcome the health disparities for the marginalized populations. Let's give a loud shout out to ourselves that we're graduating today. Congratulations, fellow Panthers, and thank you so much.
It's always a privilege to hear from our students, and all of them could give similar testimonies of their lives and the differences that they have made and will continue to make. Amna, I asked her earlier, she'll be leaving shortly to join the Pennsylvania State Health Department, working on public health, so she'll be going from It's the route from Pakistan to Atlanta to Norristown, Pennsylvania, that all of us travel. So congratulations. The next presentation is a special addition that we wanted to add to our commencement today. This year, Georgia State University-wide, and this is 50,000 students, implemented a new program called the 3-minute thesis. And what this project is started in New Zealand, and it's spread around the world, and it's a competition to allow students the opportunity to present their thesis or dissertation work, which is just for graduate students, in 3 minutes, and then have a competition and someone to be selected as a winner and a finalist for this. And it's the first year Georgia State has done it. We were very proud. They had a master's division and a PhD division. And in the master's division, there were 6 finalists from all of Georgia State, and 2 of those finalists were from public health, which we were very proud of because we are the smallest school at Georgia State, but we had a third of the finalists. And the PhD category, there were 6 finalists, and we had 1 of the PhD students. And so we were very proud that we were very well represented. But not only were we well represented, but one of our master's presenters actually won the 3-minute thesis competition. And we've asked her to share that with you today. So what I'd like to do is to invite Brittany Carter to the podium, and she will, and you can time her. She will share with you her 3-minute thesis presentation that she did in conjunction with Rich Rothenberg as her advisor. And Brittany has been a very active MPH student with an internship with the Georgia State Department of Health and involved also with the Public Health Student Association. So Brittany, will you please join me, please?
By a show of hands, how many of you know your zip code? Okay, that's a relatively easy question, right? Well, for me, I like to think of zip codes as personal identifiers because they not only tell you where you live, but they tell you what type of environment you live in. In a research study conducted by Georgia State's own Dr. Richard Rothenberg and colleagues, 10 zip codes in the city of Atlanta were examined to understand networking relationships, geographic closeness, and HIV transmission and maintenance. The people living in these zip codes were considered to be living in higher risk and lower risk areas. These risk areas were determined based on the history of HIV reporting. To put some names to these areas, in the lower risk areas, we have locations such as East Point, College Park, and parts of Union City. In the higher risk areas, we have more prominent locations in Atlanta, such as areas near the Fox Theater, near the Georgia Dome, Old Fourth Ward, and parts of South Atlanta. My thesis focused on 2 things. First, I was interested in examining the rates of smoking and visitations to healthcare facilities among people living with HIV in these designated higher risk and lower risk areas. Research has shown that people living with HIV smoke nearly 4 times more than the general population. Smokers living with HIV are more likely to develop mouth infections, lung infections, and heart disease in comparison to non-smokers living with HIV. Second, I was interested in examining stressors, or stressful events that may be associated with smoking. These stressful events can be categorized as homelessness, engaging in physical violence, or being threatened with a weapon. Living in high-risk areas may limit access to transportation and access to adequate healthcare services, but living with HIV in these high-risk areas may cause even more health consequences. My thesis hoped to shed light on the importance of visitations to healthcare facilities among smokers living with HIV in Atlanta, in our community, and in our neighborhoods. These zip codes were more than just numbers on a map, more than numbers at the end of our home address. They could determine who we are and what we do. Oftentimes, it's not about how we live our lives, but where we live our lives. So now, I would like to ask you once again, how many of you know your zip code? Thank you.
Brittany, thanks so much for that impressive and award-winning performance. You really make us proud. At this time, we would like to recognize the awarded recipients for the 2016-2017 academic year. We have 2 student awards, 2 practicum awards, and 2 faculty awards. For our student awards, we really recognize the great work of our outstanding graduates, those that have gone above and beyond in their commitment to our school and to our communities. The first award we'd like to present is our Public Health Student Achievement Award. This award is given annually to a MPH or PhD student in recognition of outstanding academic performance, scholarly contributions to the field, and service to the community. The winner of this year's award is Alexandria Patterson. Alexandria is graduating with an MPH degree with a concentration in health promotion and behavior. Her thesis is titled "The Impact of the Safe Care Parent-Child Interaction Module on Father-Child Interactions, an Examination of an Observational Measure." Alexandria has served as a graduate research assistant for 2 years with Dr. Shannon Self-Brown. She worked on the Dads to Kids project, which is a parent training program to reduce child maltreatment perpetration risk among fathers. She's also served as the public relations liaison for the Public Health Student Association this academic year. She'll be working full-time as a project coordinator in the field of maternal and child health at the National Safe Care Training and Research Center within the Mark Chaffin Center for Healthy Development in the School of Public Health here at Georgia State University. Alexandria, would you please join me on the stage to receive your award? Alexandria, would you please remain here on the stage for a moment? It's right here. Our second student award is called the Diane Caves Memorial Award. This award is named after Diane Caves, a Georgia State MPH student who was killed in the 2010 Haitian earthquake while on assignment with the Centers for Disease Control and Prevention to work on the President's Emergency Plan for AIDS Relief. This award is given annually to the student who best exemplifies the selflessness and dedication to public health that Diane exhibited. I'm pleased to announce that Alexandria Patterson is also the winner of this award. While today is a day to celebrate the great achievements of our students, we also recognize as a school that we're not alone in the quest to develop the next generation of public health researchers and practitioners. There's a broader community that contributes to the professional development of our students, and today we would like to recognize our community partners who have mentored, supported, and promoted our students. Our first award category recognizes the Practicum Preceptor of the Year. Nominees for this award are submitted by students, and the recipient is chosen for their outstanding mentorship and leadership in a public health practicum. The School of Public Health would like to recognize Tim Frederick from the Environmental Protection Agency Superfund Division. Mr. Frederick, would you please join me on stage to receive our gift of appreciation for your contribution? Our next award is one that recognizes more than just one individual. It recognizes a public health organization for its demonstrated commitment to our graduate students through ongoing provision of high-quality practicum opportunities. This year's recipient is the Captain Planet Foundation. They could not be with us today, but please join me in recognizing them for this award. Next, we want to take an opportunity to acknowledge faculty awards, and to do so, I want to invite Dr. Jidong Wang to the podium to present those awards.
Thank you. This year, we're going to have 2 faculty awards. The first award is the Excellence in Instruction Award, which recognizes the full-time faculty member in our School of Public Health for outstanding achievement in instruction. And this is presented to a faculty member who displays outstanding achievement in promoting student learning. And this year's recipient is Dr. Betty Lai. Yeah. Oh, it's this one. Yeah. The second award is the Exceptional Service Award, which recognizes a full-time faculty member who has made unique and meritorious contributions who have benefited the School of Public Health and the broader community. And this year's award recipient goes to Dr. Kim Ramsey White. Thank you.
Let's congratulate all our award recipients. Next, I have the honor of introducing our alumni speaker. Michael Brandon Talley graduated in 2010 from our MPH program with a specialty track in health management and policy. His thesis was titled Examining the Impact of Development, Tobacco Taxation, and Tobacco Prices on Global Adult Male Smoking Prevalence. Today, Brandon is the Vice President for Programs at the CDC Foundation. As Vice President, he's responsible for nearly 125 employees and more than 300 projects that range from emergency response to core programs implementation. Prior to his work at the CDC Foundation, Brandon worked for various nonprofit organizations. He also spent 10 years working in various management positions in the private sector. He is the inaugural and sitting board chair for the GSU School of Public Health Alumni Board, and he is a member of the school's Board of Advisors. Brandon is also a current student. He's in our PhD program in biostatistics. He recently received his first research grant to study knowledge and perceptions on electronic nicotine delivery systems among primary care practitioners. Please welcome Brandon to the podium.
So I have to say, putting me right behind the awards ceremony is a pretty tough act to follow. So congratulations to all the award recipients. I think that just speaks to the amazing quality of the faculty and students here at the School of Public Health. So congratulations. It's great to be with all of you this morning and to celebrate your achievements. I myself, as Rodney mentioned, was celebrating receiving my MPH just a few years ago. And I hope to look forward to being back here in the not too distant future, completing my doctorate degree. I came to the School of Public Health after a major health crisis in my own life taught me I needed to give back more than I take from the world. Now, I am honored to lead a team of people as the Vice President for Programs at the CDC Foundation. And I am proud to say that that team is populated by a number of excellent graduates of the School of Public Health. I have been so fortunate to work with this team of GSU grads and to be involved in work that is meaningful, purposeful, and touches millions of lives. But now is the time to talk about you. It is time to think about what you're going to do with your degree. I can attest that the faculty here at the School of Public Health have prepared you well for moving into careers where you will address the public health challenges of our time. What I gained here that has served me best in my career so far is understanding the value of a community of practice, learning, and friendship. And beyond that, how that community can empower positive change in lives around the world. As the chair of the School of Public Health's Alumni Board, I also want to talk to you about how I hope today you're not ending your journey with the school, but just starting it. Your connection doesn't end when you are handed that degree. Let this institution serve as the cornerstone for your professional network. Continue working with your professors, who are now your esteemed colleagues. Make a habit of including the school in your personal philanthropy with a gift each year. And perhaps beyond that, the most important thing you can do is show up for the next generation of public health students who will benefit from your time, talent, and wisdom. Whether it's speaking to a class once a year, notifying the career office about job opportunities with your employer, or serving as a mentor, your continued engagement on behalf of our students with the School of Public Health beyond graduation is vital to the continued success and growth of the institution. And as you are all now alumni of the School of Public Health, I hope to see many of you on May 18th when the School of Public Health will serve as co-host for an alumni event, Association's Third Thursday Happy Hour at Marlowe's Tavern at Emery Point. So I hope to see you all there. Thank you once again. Congratulations. It's such an exciting opportunity to see the school have grown so much in such a short amount of time. Congratulations to the graduates and their loved ones who supported them through all the process of getting to this day.
Did anyone catch the date that Brandon said he was going? No, not the date of the happy hour, the date of your PhD graduation. Summer. So this is part of our responsibility to nag our students, to get them as great an education as possible, but to get them out the door so they can continue to make a difference. And this brings us to the time we are all here today. So if I could ask the graduates to please stand. By virtue of the authority designated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree prescribed in the original official records of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. Graduates, congratulations. And as a sign of your accomplishment, please turn your tassel from the right side to the left.
And now it's time to individually recognize this year's graduates. Is everybody ready? I am, and I'm very proud of each and every one of you. So please approach the stage. Barbara Yankee, PhD, Public Health. Francis Adams. Anika Alam. Jabril Alim. Jacob Allen. Nur Bakhtir. Mai Tili Bhat. Alexandria Blake. Jordan Brown. Portia Bushongo. Brittany Carter. Sharon Caslin. Ordino Collins. Andrea Collins. Santana Comer. Leila Kompani. Bonaire Dunabani. Sushma Daha. Bria Eckert. Prince Iminalo. Olu Milola Fukonle. Katie Frencher. Jency George. Evan Graham. Haley Hamilton. Alicia Jackson. Nerlene Jacques. Sarah Kabani. Brittany Knott. Camille Kramer. Nina Lee. Charles Lee. Megan Mallet. Ali Michele. Omkar Migal. Elena Moon. Ambra Noble. Crystal Oliver. Diana Orchiola. Josephine Osage. Yasmin Othman. Payal Patel. Alexandria Patterson. Lauren Potts. Laura Riquelme. Kayla Roby. Kimberlyn Rusa. Zainab Salah. Mariam Shakil. Farana Suleiman. Ola Sunkami Sunumu. Amna Tariq. Tinti Von Tron. Hope Ukbuke. Tejal Vashi. Tyra Wangnu. Erica Weary. Ryan Wilkerson. Robin Williams. Rahab Zahidi. Let's have a nice round of applause for all of our graduates. Congratulations!
This is a very, very special day. And the graduates are the focus of our attention, and their futures excite us in terms of the differences they'll make. And they wouldn't be here without a lot of sacrifice and diligence and commitment to interrupt their lives, to pursue a graduate degree in a field that will make a difference in others' lives. But it was not a journey that they achieved on their own. They would not have been here, they would not receive their master's or doctorate without the support of the people in the audience behind them. So, graduates, please thank your family, your friends, and your supporters to help you get in here. And next Saturday, my son is graduating with a master's degree, and I'll be going to his graduation. And I have great pride in his accomplishment. So parents, friends, family, children, one more time, hear it for the graduates, please. And finally, I'd just like to make it clear that the graduates would not be here and enjoying this day and celebrating without the support of the family and friends, but even more fundamentally and often totally unrecognized is the support and hard work and dedication of the faculty of Georgia State University. So please join me. Please. Come on, faculty. This is a world-class group of faculty that provide a very special experience for our students here in Atlanta. As mentioned earlier, the public health headquarters of the world, really, in terms of expertise and opportunities and needs as well. So we appreciate everyone's hard work, family and students and faculty and staff, particularly, lastly, for Denise and her group for putting this ceremony together, which is no small feat. So Denise, please, and Denise's staff. Let me conclude by simply saying how proud I am to have this opportunity not only to convey the degrees today, which is probably the only time I will ever have that opportunity, as you already heard me say, but also to provide the leadership for the School of Public Health at Georgia State University. It's been an incredible opportunity. Our students and faculty are making a difference. We're succeeding in all of our every way possible in terms of our graduates and in terms of our research. This year we're at a new all-time high in external research dollars. And the one thing I just wanted to leave you with and share is that our student body is very special. Our students, we have the largest number of Fulbright scholars of any university in the country who study public health at Georgia State. Georgia State each year gets 10 Fulbright students from around the world, and 8 of them study in public health. So we're the focal point for global Fulbright scholars at the university and get more than anywhere else. So we're very proud of our students. And then lastly, just to let you know, something that we're very proud of is our student diversity. I know Atlanta's a diverse city and we have a diverse student body, but I actually looked into the numbers, and we have the greatest percentage of African American MPH students and PhD students than any school of public health in the country. So we have a very special group, diverse in every way, age and gender and training previously and what they're going to do in the future. And it's a privilege for us to have the opportunity for you to spend a few years, not too many years, but a few years with us to advance your career. So again, congratulations and thank you, family, for your support and being here today. Thank you.